Hi, this is Uriel Kim from TotalWellnessCleanse.com. First off, I'd like to apologize for the formality of my attire, but I'm actually just on my way out to a function. But I thought I'd stop in very quickly and talk to you about a very, very important health matter, which is called leaky gut syndrome. That is the way it is called, and basically what it is a leaky gut, and that's pretty much what it is. To help explain this, what I'd like to do is call upon my prop right here. So what this is a rendition of your small intestine, okay? Now naturally in the small intestine has these pores, right? Notified by these little holes here that I've punctured with a knife into this cardboard cylinder. So this interior would be the lumen of the small intestine. That's where all the food stuff goes through, the bowels move through there, and basically makes its way down to the rectum, right? Now the small intestine is a very, very important area of the digestive system because that's where a lot of most of the absorption takes place back into your body. So naturally, we have foods that are broken down, the nutrients pass through the lumen and come through and out of these pores back into the bloodstream. They go to the liver, they get processed, and they do the thing. Now leaky gut, what happens in leaky gut is that these pores actually widen, right? So the pores get wider, right? There's things that happen in the body that open these pores up and make them wider. Now what the problem is with this is that normally this intestinal wall forms as a kind of a semi-permeable membrane. So it allows certain things to go in and blocks certain things from entering the bloodstream. For instance, it'll allow specific smallly broken down molecules and nutrients to go through the small intestine and back into the bloodstream. It will prevent toxins and undigested food particles from entering the bloodstream, which is what we want. But what happens in leaky gut is that because the pore now becomes bigger, larger, undigested food particles can make their way through these pores. Toxins can make their way through these pores and into the bloodstream. That becomes a big issue because that is how allergies develop. Undigested food proteins, for instance, are what cause immune responses. So for instance, if you have an apple, just as an example, you don't chew the apple properly, it doesn't get broken down properly in your digestive system, it gets into the small intestine, and now that undigested food is actually big enough to get out of the small intestine and back into the blood. So even if it's something as healthy as an apple, the proteins within that undigested food particle will be picked up by the immune system, and the immune system says, hey, this protein should not be in the blood. We're going to mount an immune response to it, and that's how allergies develop. Right? That's also how autoimmune diseases or autoimmune disorders develop as well. Right? So leaky gut syndrome is a big issue. The other thing with leaky gut is that toxins from our bowels are basically allowed to come back into the blood, right? Because instead, so for instance, let's say this is the small intestine or large intestine, we have waste that is sitting inside, right? So it's sitting in here, and all the fumes, the toxins are able to now seep out because these pores are a lot larger. So we talked about auto-intoxication in the constipation video, right? The toxins come out of these pores and back into the bloodstream, and that's not something we want. So how does leaky gut come about? Well, there's a few things, and again, we talked about this in the constipation video. If waste sits in your colon, if it sits in your small intestine, what that does over time is the toxins within that waste irritate the lumen, right? They irritate the lining in here of the small intestine, and what that does is over time is it naturally creates an environment that leads to inflammation and the widening of those pores. Okay, so you have irritation caused by waste fermenting more or less, right? You have waste sitting in there, it causes the widening of the pores by irritation and inflammation. And the other thing with that is that over time, this constant irritation can lead to chronic inflammation, which ends up becoming an irritable bowel disorder, such as Crohn's disease or colitis, right? Colitis is inflammation of the colon, right? So those are just a couple examples of what can happen. The other common reason for developing leaky gut is that there's an imbalance in the flora within your colon, right? So the bad bacteria versus the good bacteria, the yeast, the molds, the fungus, all that stuff. If the scale is tipped in favor of all the bad stuff, right, all those little critters can now make their way back through the digestive system. They can actually sit, right? They can actually sit in here and attach themselves to the intestinal walls, and again, creating that irritation. They expel their waste, they expel their toxins, they create that irritation along the intestinal walls, widening the pores and allowing things to move through and out of the small intestine. Right? So leaky gut is a very, very big issue that is not often talked about in the medical community. As a holistic nutritionist myself, this is a big focus of what I do, because in order for things to work properly in the body, you have to heal the gut, right? You have to heal the digestive system for it to be able to work properly. And there's a number of ways to do that, right? For instance, one of the first things that you can do is take glutamine. Glutamine, you know, bodybuilders use it very often for developing muscle, but glutamine, L-glutamine, you can get it at any health food store, is a unbelievable amino acid for healing soft tissue, or very delicate tissue such as the lining of the colon, the lining of the small intestines, the lining of the digestive tract. Very, very good for improving the integrity of your gut. So L-glutamine, you take about 5 milligrams once or twice a day, and you're fine. 5 grams once or twice a day. The other thing you can do, obviously, is take a probiotic, right? You want to get that balance back in the large intestine of the good to bad bacteria. So you want more good bacteria, so get the probiotics in, and not through yogurts that develop their own strain of bacteria that's never heard of in mankind. You want to get natural probiotics. Kefir is a great source if you like the yogurt and dairy stuff, although I don't recommend dairy at all. I would recommend that you try maybe some fermented foods. Even sauerkraut is a great option, or you can just take a good probiotic from a health food store, right? Take 1 or 2 a day. Make sure you get billions of those good bacteria coming into your body, and that'll help rebalance things out. So all that combined, and there's a lot more to do. I mean, obviously, I gotta run. I know you don't have all day to watch this,